As we've reported, the Mower County Justice Center shut down last week due to COVID-19 cases. It's affecting various aspects of business for folks who work there and for those who need services through the departments at the Justice Center. It remains closed tonight. And Sheriff Steve Sandvik is one of the people who made the decision to close the center, and he joins me from Austin. What exactly happened last week that prompted this announcement and the closure, and is it completely closed right now, Sheriff?
No. First off, it is not completely closed. We just throttled back to by appointment only and posted the phone numbers in both our press release and on the doors for people so they can still make contact with the offices they need to. But this was all prompted by a sudden upswing of cases of COVID within staff members who work within the Justice Center. And out of an abundance of caution in working with the department heads within that department and notifying our county administrator, we made the decision to close the Justice Center to the public, except for by appointment only, in the utmost precautions to protect the health of the public and the people who work there, to make sure we have a good handle on it.
Yeah, let's talk about the offices that are by appointment only and how many people who work there that this is affecting.
Well, it's our county attorney's office. Also, the state court administrator's office is housed in that building, as is our county corrections department, and then our jail.
Yeah, I was going to ask about that because the jail, when COVID cases are showing up in some of the places for jails or even within the state prison system, that brings in a whole nother dynamic. What have you been doing with those who have been housed there and then your guards and all other staff?
Well, our staff has done an extraordinary job, as have our criminal justice partners. So we work very hard to get our population down, which gives us the ability to segregate people for a full 14 days to make sure that people coming into our facility aren't contagious or have symptoms. And so that way we're limiting the possibility of it spreading within our facility and making sure we're doing everything we can to protect the people we're expected to serve and house in that situation.
I know that you have received your vaccinations, and a lot of our first responders, under which your deputies would fall, were in the top tier to get vaccinated. How has the vaccination distribution process been going for those in the Sheriff's Department?
Well, it's gone very, very well. I'm so proud our emergency management team and our public health department have done such a great job. It has been somewhat frustrating for people statewide and across the nation because you need to actually be given the vaccine before you can set these up. So they've done a very, very good job of advocating to get vaccines in county and then assisting in setting up the clinics and getting it into the arms of people who choose to take it. And so we've had a very good turnout of people who've opted to get the vaccinations. And very thankfully, minimal side effects, if any, in most of the people who received it. And so we're happy about that, and kind of continue to encourage people to let's stay the course, let's keep our social distance, let's keep our masks on when we're out in public, wash our hands, disinfect surfaces, and let's all work together to try to get beyond this. We can open up like it never happened.
Yes, that would be good, right? And that is the goal for all of us. But we've had some instances in Olmsted County, in Rochester, because of whether it's mask wearing or whatnot. People are getting a little bit more tense as we continue to go on and waiting for the vaccinations to open up to the general public. How have things in Mower County been?
Well, all in all, very good, but I think everybody has those same frustrations. And we just ask that people be patient. We're all working hard in emergency management, public health here in Mower County and really across the entire state to make sure we're doing everything we can to get the vaccinations out, make sure people have the ability to get testing, and if they do get sick, have the proper connections to know who to contact and to know what to do. So we're not going out in public when we're sick. If we need to quarantine, we need to do that. It's very, very important that we all stay the course and continue on. Quite honestly, Minnesota's numbers have gone down because of the hard work the people in our communities have done. And so many of our businesses have made such enormous sacrifices. I would hate to see that turn the other way and go all for naught and have to see the dial turn back.
Yes.
So to speak.
When do you expect things to reopen, best case scenario?
Our plan would be, it would be opening up on Wednesday the 17th. Again, for in-person business, unless we would see a change or have more numbers start popping up. Primary concern are the people who, in those departments who did become ill with COVID. Their health, their well-being is primary concern. Once they're able to come back, we're anticipating reopening for full normal in-person business on the 17th. But we also have to work with our state partners to make sure they're appropriately staffed and we're meeting the safety and disinfection needs as we go forward.
Well, I do hope all your men and women there get healthy and remain healthy. Glad that you got your vaccination, Sheriff. Thanks so much for taking the time to talk to me.
Thank you very much, Betsy. Appreciate your support.